Black Lives Matter protesters across the U.S. are looking to do more than just tackle racism in the justice system. They want racism to be recategorized, considered a public health crisis, an emergency, if you will. And the sentiment is actually backed by a number of national medical groups. So we're going to dig into this. I want to bring in Katherine Ellen Foley. You are a science and health reporter for Quartz, and you wrote a really interesting article taking a look at what it means to shift our perspective and essentially see racism and systemic racism as another epidemic, sort of like the coronavirus. And you say this is nothing new to many medical groups, that they have long acknowledged the harmful health impacts of racism. But they called it something else. They called it social determinants of health. Can you define that term and tell us what it means?
Yeah, of course. So when we think of social determinants of health, we often think of social and economic factors that could ultimately play a role in someone's physical health. So in the case of racism, we've always considered, or public health professionals have long considered race and gender to be one of these social determinants of health. And ways that it could play out are, living a life full of stress, right? That stress, that fear of, or even the trauma of microaggressions or major aggressions based on the color of your skin. It's not race itself, it's the way that people are treating you and the way that systems are treating you. Underemployment or unemployment, that could affect your access to healthcare, whether you can afford to get regular visits, which ultimately plays a role into your health. Where you live, if you're being exposed to a higher level of certain pollutants compared to people who live in a different neighborhood, that could ultimately play a role and does ultimately play a role in physical health. So while for a long time we've considered race and ethnicity as these social determinants of health, it's not necessarily those factors on their own. It's more how society treats them and like what happens to people as a result of their race or ethnicity.
So Katherine, you lay out several different campaigns health officials suggest in combating racism. And we're talking about, as you say, the mental health effects that racism can have as opposed to the systemic racism that exists, for example, with policing. But what are some of those campaigns, and have any of them been successful, I guess?
Well, I think when we think of public health campaigns, we think of modern ones or ones that have been, I guess, created since, I don't know, that have more focused on individual action. So we think of things like the Truth Initiative, which is a campaign to try to combat youth smoking. We think of, friends don't let friends drink and drive, right? That's a normative health approach or health campaign. Oh, geez.
I thought it was very interesting in the article that you sort of point out that these public health campaigns, like even when you think about the coronavirus, everyone wash your hands and sing happy birthday, kind of identify one singular thing that you can do, but fail to acknowledge the reasons why people may behave in a way that doesn't seem protective of their health, right?
Well, yeah, and actually, I think that's a really great example, right? Like that, the idea of washing your hands, that focuses on a specific action that you can control, right? A specific individual action that you're trying to get people to adopt. And that's great. It would be really great if we could just have a campaign that said, hey, everybody, please stop being racist. That would be awesome. But unfortunately, racism is a systemic problem. It is not something that, like, while it is good to individually be anti-racist, it is not enough to eliminate the problem of racism. So a lot of the folks that I spoke to said that if we're going to really combat racism as a public health issue, we have to follow it all the way back to where it starts. And a really good example of this is when Dr. Martin Luther King Jr. led his campaign against slums in Chicago. So that was back in the late 60s. And he and the others who organized that particular campaign in Chicago were really focused on not just ending slums or poor, inadequate housing in Chicago. They were really working with community leaders then to say, okay, how can we make sure that people are employed adequately and have enough money? How can we make sure that the education system is better? How can we make sure that people have better access to healthcare? So that was really a systemic, that was a single issue, but it took a systemic approach to start to rectify it. And he also made sure to involve a lot of community leaders in making those decisions that would ultimately make sure that Black people living in Chicago had better access to overall health by being more economically secure and having adequate access to housing.
I think that is a very refreshing approach. Often what we focus on, if you want to use the analogy of an illness, are the exterior symptoms of systemic racism and never really go after the virus, if you will. But a few cities have done exactly this, declared racism a public health crisis. How has that manifested itself in those cities? Are there new programs, more money? What does it look like?
Well, I think that the first step of tackling any problem is to recognize that there is a problem, correct? So acknowledging and trying to understand what systems are actually in place is hugely important. And I think that it's a little bit too early to say exactly what will happen in these cities, or I think the state of Ohio has even declared racism as a public health issue, or is trying to. So it's still too early to say what the fallout of that will look like. But I think acknowledging and trying to examine the systems that are in place and really look critically at them, because I think, unfortunately, a lot of these systems have been in place for so long that it is they're harder to see. So I think the first step will be taking a really critical eye to looking at what's in place, what's preventing people from getting adequate access to healthcare, where are the majority of people of color living in these different neighborhoods, why are they living there, do they have adequate access to getting mortgages in different areas. All of these kinds of things ultimately play a role in people's physical health.
I'm really interested in what could potentially be done at the federal level, Katherine. We've talked a lot about in recent days defunding the police, which means perhaps diverting funds to issues just like this one. We know that there is legislation being worked on by both Democrats and Republicans with regards to policing in this country. But would this be something that might perhaps be easier to tackle on a bipartisan basis, taking this health crisis, this specific one, to the federal level, and what that kind of legislation might look like?
That's a very big question, and I'm not sure I have a concrete answer for you on that. I think that a lot of the same efforts that, or a lot of the same ideas that are being talked about in the campaign, in when people say defund the police, are also present in addressing racism as a public health issue. So if that means making sure that people have better access to mental health support, or have better access to supports or services to keep them in their housing and make it so that they're not experiencing homelessness or unstable housing, and have adequate access to nutritious food, all of those are great programs and great ideas. But I think, as I said before, for the federal government to tackle those and to say that they want to tackle those, it requires looking a lot at the source of all of those problems, and that can require going back very, very far. So I do think that the ideas are related, defunding the police and tackling racism as a public health issue. I think that a lot of the tangible steps that people want to see taken are the same. Perhaps that is something that could have more bipartisan support. Although I think when you really look at what people are asking for, it doesn't seem like it should be a partisan issue. It seems like people are asking for just more support for their communities in general, and not just in law enforcement, but in better access to services that would ensure their overall physical and mental health.
Mm-hmm.
Such an important subject. I'm really happy that we're talking about this, because I just think that we often sometimes lose track of all the different facets of systemic racism and how they affect people. And it's not always very clear, I think, because people are sometimes reacting viscerally and in real time to things that are happening, things that are in the news cycle. And essentially, Katherine, what you're pointing out is this is something that has existed perhaps for almost the 400 years that African Americans have been in this country. So we really appreciate the time and effort that you took in being with us. I know you had some internet issues. We appreciate it, and we appreciate your reporting.
Yep. Thank you so much for having me.